to another installment of our Whiteboard Wednesday videos. Today we're going to be discussing a little bit about medical histories. Now when you come to the dentist, it's kind of a little odd, but there's a reason why we ask for your medical history. Many of the systems of our body are connected, and actually a lot of the initial symptoms of systemic diseases show up in the mouth. So the more we can get information ahead of time, the better. Now, another thing about your medical history is past drug use or current medication use. Many of the medications that we use to treat systemic diseases have side effects and have maybe some drug interactions with things that we do orally or with dental needs. Some of the main topics in a medical history that we're interested in, now these are by far not a comprehensive list, but a few of the main reasons why we ask for medical history are including certain diseases and symptoms such as diabetes, smoking, high blood pressure, heart disease, and past drug use. Now, as I said earlier, there's many things we look at in a medical history, but those five main areas are the areas we really are interested in for specific reasons. A couple of them, smoking and diabetes, have a large impact on our periodontal health, both in the disease itself and its progression, but also in its ability to heal. Tissue does not heal well in the presence of diabetes or smoking, so we're really concerned with that. Heart disease and high blood pressure also can affect our dental care. One of the things that is very concerning to me is when patients come in with very high blood pressure, there can be negative interactions with their medications they're taking to try and control that, and things that I may prescribe them to take care of dental needs. Another issue is if you're already having or suffering from high blood pressure, sometimes we use anesthetic to make teeth go to sleep while we're working on them. Anesthetic has a chemical in it called epinephrine that is very necessary, but can also have an adverse side effect of increased heart rate and increased blood pressure. So if our blood pressure is already elevated and then we elevate it more because of the anesthetic, we can have some negative impacts that way. Past drug use can affect how well our anesthetic works. For example, patients that have had a history of drug abuse, even though they may have kicked that habit or that abuse, their body has already built up a tolerance to drugs. So when we try and use anesthetic to numb and make patients more comfortable, we either have to use a lot more, or we may have to go to sedation, where you actually have to go to sleep because the anesthetic is not as effective because of the past drug tolerance that's been built up. So next time you're in visiting us, or if you're new to our office, please make sure that you fill out your medical history as thoroughly and as accurately as possible. If you have any questions, please let us know. We're here to help. So be sure to like, comment, and share this video. Thank you for giving me a few minutes to share this information with you. Be sure to watch next month as we talk about how to replace a missing tooth and why it's important. Thank you.